We'll keep tracking developments of what's going on in the tropics, but even before this started to develop, emergency management teams were already working new plans for keeping South Florida safe during the pandemic. Here's NBC6 investigator Willard Shepard with what he found.
Hurricane Irma brought lots of wind and water, but this storm season would be different because of the pandemic.
You're safer with us.
That's the message from Frank Rollison, director of Miami-Dade's emergency management, to the 2 million people in evacuation zones. In all, the county has 82 shelters that could house 112,000 people who have no place else to go. And while for months you've been told to stay home, if a hurricane warrants it, the county hopes people will feel safe at a shelter.
The challenge is going to be, will they come? Will they listen, and will they leave their homes and come to the shelter because of the fear of being in an atmosphere that's conducive for, transferring the COVID virus?
In shelters, the county says it's trying to provide as much social distancing as possible.
And we will double the distance in between people, which will give roughly 6 feet between the individuals.
And a system like the one at this field hospital at the Miami Beach Convention Center may go up at 20 shelters.
And in those buildings, they put in what they call a pole and drape system, where they actually develop cubicles and with dividers between there.
To get inside the shelter, there would be a temperature check and questions to answer to determine if you and those with you need to be quarantined.
And we will separate those families into those classrooms to where they can be together.
Each person gets meals ready to eat, face mask, gloves, and hand sanitizer.
We have ordered individual kits, a couple 100,000 of them, to give to each person that comes in.
Over at the room where they would coordinate the response with police, fire, cities, and charities, the plexiglass is now up. The hope is, though, outside of Rollison, the room will be almost empty because the teams will do their work remotely.
We've run one test already to where we can run this EOC virtually from a distance.
The experts tell us they're really worried that people who live in these evacuation zones where they really should get out won't because of COVID-19. And that decision could end up putting them in more danger. Willard Shepard, NBC6 News.